My name is Francisco Hernandez, and I will be talking about the inappropriate prescribing of antibiotics for upper respiratory infections. For some background information on the inappropriate use of antibiotics, in the US, about 10 million children are inappropriately prescribed antibiotics. This adds up to about 40% of antibiotics that are being prescribed unnecessarily. A good portion of these prescriptions are due to RT or acute respiratory tract infections, which include bronchitis, otitis media, pharyngitis, sinusitis, tonsillitis, the common cold, and pneumonia. And of these, bronchitis is the most common diagnosed acute respiratory tract infection. Bronchitis is normally caused by viruses, which do not need antibiotics. So when patients are inappropriately being prescribed antibiotics worldwide, this is contributing to the antibiotic resistance concern that has caused around 23,000 people in the US to die from antibiotic resistant infections every year. When a patient is infected with HIV, in the early stages, the gut populations of lactobacillus and bifidobacteria are reduced. These organisms help with the gut barrier, and the reduced amount of those organisms compromise that. Antibiotics can increase HIV disease progression by eliminating those organisms before HIV does, worsening prognosis for the patient. Preservation of lactobacillus in the gut is associated with better outcomes for HIV. Antibiotics also directly induce the expression of key genes that affect the stress response. It is suggested that there is a two-way communication between the gut microbiome and the brain, affecting conditions such as stress and depression. Repeated use of broad-spectrum antibiotics in children under 24 months of age increase risk of obesity by altering the intestinal flora, affecting long-term energy homeostasis. Another thing gut bacteria affects is asthma. Although there are little studies done to confirm this claim, there is evidence suggesting that there are differences in the gut microbiome in both asthmatic and non-asthmatic patients. So what is antibiotic resistance? It is a phenomenon that is increasing at high levels in all parts of the world, causing it to be one of the biggest threats to global health, food security, and development. Bacteria can become resistant either naturally or through misuse in one part of the world and spread globally, making it harder to treat infections no matter where you are. Countries without standard treatment guidelines or places where antibiotics are just straight up overprescribed in both health workers and veterinarians accelerate this process. So this is a concern in both humans and in animals. There are a number of infections such as pneumonia, tuberculosis, gonorrhea that have been getting harder and more complicated to treat as a result of antibiotic resistance. This leads to a patient being in the hospital longer till the healthcare system can figure out how to treat the resistant infection or having to use a more expensive antibiotic therapy, which all ultimately lead to higher medical costs. These once mild and easily treatable infections have led to an increased rate of mortality, so people are dying more often from these infections that were once easily treatable. So next, we're going to talk about why antibiotic resistance is a concern. The most common healthcare-related infection affected by antibiotic resistance is the C. diff infections. There have been increased cases over the years of C. diff that do not respond to standard therapy and are causing complications for patients and the healthcare system. Like mentioned earlier of the effects of antibiotic resistance, C. diff infections are responsible for an extended day at the hospital up to almost 10 days and cost $6.3 billion annually to healthcare system. When treating an infection, adding an antibiotic to their regimen, if it is not needed, is just adding the risk of more potential side effects that can be avoided if the infection was treated properly. Some people do not respond to antibiotics very well and can be quite unpleasant and was 100% preventable. Now I'm going to talk about why antibiotic overprescribing is occurring. According to physicians, the demand from patients or the parents to get some type of antibiotic for all sorts of infections is one of the biggest reasons that people are getting antibiotics when they do not exactly need them. When a patient walks into a clinic or any doctor's office, especially if they are feeling ill, would like to leave with something tangible instead of being told to just wait it out, which is often the correct course of action. So if a patient walks out with nothing to show for the visit, they tend to think that it was a waste of time to even see the doctor. And when a patient feels this way, the physician rightfully has a fear of losing that patient to another physician who will prescribe something for their illness. This is all due to the lack of education of these parents on the correct use of antibiotics. To show some numbers on the effects and causes of antibiotic resistance, we see that the initial interaction with healthcare predicts if a child returns for a subsequent acute bronchitis episode. The association between prescribing as part of the initial episode of care and prescription of an antibiotic during the subsequent episode showed that children who were prescribed antibiotics on the first initial visit had more than double the hazard of being prescribed in the subsequent episode compared with those who were not prescribed as part of the initial episode. Also, when surveyed on their knowledge, it was shown that 22.2% and 19.3% respectively of parents incorrectly believe that most colds and flu illnesses are caused by bacteria and get better with antibiotics. There are also misconceptions about whether or not to use antibiotics when there is color in your mucus. 72.8% believe that when you have green rhinorrhea, then you need an antibiotic versus 11.6% who think when your rhinorrhea is clear, you need an antibiotic. But in either case, more often than not, an antibiotic is not necessary. In another study, it was shown that parents believe that giving their children antibiotics would help their child return to the daycare sooner, which is a big motivator in deciding whether or not they demand antibiotics from their physicians. How can we help against antibiotic resistance and overprescribing? One of the biggest methods is to simply educate parents and patients about which type of illnesses need antibiotics. Another thing is when talking about their diagnosis, the use of the word infection can put in the patient's mind that they need an antibiotic. One of the biggest things was that patients left with nothing from the doctor's office. So having the patient leave with medications that treat symptoms, such as the fever, pain, runny nose, can maybe help with the physician's satisfaction. Another method is delaying prescriptions of antibiotics. This means that a doctor can prescribe antibiotics but counsel the patient to not take it unless the symptoms persist for several days. Hopefully, with these, we can prevent any further complications from antibiotic resistance.